kind of bypass the introductions and just get right to our agenda. I'm Ron Hansen with LA Health Action. Thank you everybody for coming today. By the way, somebody may be coming around and taking pictures of you for a publication, and in order to publish those, you need to sign a release that will be left on your tables. If you don't want your picture in a publication, don't sign. In the first hour of our presentations today, we're going to have Dr. E. Richard Brown, Director of the UCLA Health Center of Health Policy Research, and Dr. Walter Zelman, Chair of the Department of Health Sciences and of Cal State University of Los Angeles, talk about national health reform. And in the second hour, Dr. Scott Graves of the California Budget Project, the Senior Policy Analyst, is going to talk to us about the state budget, what happened, and where we're going. And in the third hour, Dr. Susie Baldwin is going to present some key findings from the Department of Public Health study on health outcomes and behaviors, healthcare access, prevention, and social environment issues. This is each one of these presentations could really be a semester of seminars for each one of our presenters, and we're giving them each a very short time to present. So I would like to begin just by moving into our presentation, and at a certain time we'll have a chance to introduce ourselves. We did not build in a break for today, so if you need to leave the room, just go ahead. The bathrooms are down the hall in that direction. And so we're going to get started. So I might invite our first two speakers to come up to the platform, and I'd like to introduce them. Dr. E. Richard Brown is the director of the UCLA Center of Health Policy Research, which he founded in 1994. He is nationally known for his seminal work in documenting the nature and scope of the problem of the uninsured. His research on health access and other population health issues has been a common source of reference for government leaders and healthcare advocates in the formation of public policy and legislation. Dr. Brown has been extensively involved in the analysis of healthcare reform at the national level. He served as the senior health policy advisor to the Barack Obama presidential campaign and currently serves as consultant to the President's Task Force on Healthcare Reform. Dr. Brown is, you like that? you still do, I hope. You'll explain. Dr. Brown has been extensively involved in this, and he is the past president of the American Public Health Association. Today he's going to address the prospects of meaningful national health reform and how the hurdles we're currently facing we may either overcome or not, and what are the prospects today of achieving success and full implementation of reform. Dr. Zelman was the visiting professor at UCLA Center of Health Policy and visiting professor at the Department of Health Services at UCLA School of Public Health during the data collection phase in writing Swimming Upstream, the Hard Politics of Health Reform in California. He is now chair of the Department of Health Sciences at California State University at Los Angeles. In addition to his present and past academic roles, he has served as a public interest lobbyist, a candidate for public office, a special assistant to a California commissioner, a Clinton White House healthcare advisor, and president of a California Healthcare Trade Association. He has published numerous articles on healthcare and California politics and 2 books on healthcare market change and health policy. Dr. Zelman will discuss his recently released report, Swimming Upstream, the Hard Politics of Health Reform in California, and how the lessons learned there in our state effort can provide important lessons and pitfalls to avoid at the national level. Which one of you would like to come first? Okay, Dr. Brown, it's up to you.
Thank you, Ron. I have just one correction to make. in the introduction, and that is that there is no current President's Task Force on Healthcare Reform. That was a creation of the previous effort at healthcare reform. And what's interesting, and Wally and I were just talking about that, is that the product of the current process and the product of that previous one 16 years ago have a lot of similarities. What we hope will be very, very different will be the outcomes. And Wally's going to talk more about the outcomes. I'm going to talk about the problems we face and the broad consensus that I think exists between the White House and the Congress on healthcare reform proposals. I'm going to go over the problems very quickly because I know with this audience, with all of you, and I know many of you, that you are very familiar with these issues. So I'm merely going to touch on them just to remind us all of the nature and magnitude of the problems that healthcare reform is intended to address. We have some 46 million uninsured in the nation, nearly 7 million uninsured in California. We have another 25 million people in this country who have health insurance that doesn't cover them for essential, expensive medical care. Things have gotten so bad that the greeting card industry has had to actually market two different kinds of cards for people to get well, to send people when they're sick. One for the insured and one for the uninsured. The uninsured has become such a big and distinctive market. The second problem that we face in our system that healthcare reform is intended to address are rising costs, which you know very well. Rising costs have been pushing health insurance coverage out of reach for increasing numbers of working families in this country. They've created the costs of health care and of health insurance have created tremendous strains on working families themselves. Their contributions, just for employment-based coverage, that is the worker share of those costs, has more than doubled in this decade, while their wages have gone up a fraction of that amount. Some 4 out of 10 Americans have medical bills they're paying off or medical debt which they are carrying from year to year. And this, of course, has put a strain on employers. It has put a strain on government tax revenues. For Medicare costs and its growth are a significant contributor to the federal deficit. Medicaid costs and their growing share of state revenues has created tremendous pressure on the states. On average around the country, the average state spends about 20% of its revenues on its Medicaid program. And clearly, that's a problem in California. California has numerous other problems that I know Scott is going to address. We have a system that has extraordinary administrative costs. We spend a greater share of our healthcare dollars on administering our system than virtually any other system in the world. And that's because we have very